familiar faces here, old faces. Jim, I want to thank you very much for inviting us back to the RMA and the board. Thank you very much. I'd like to clear something up. We are not affiliated with the WTC. We don't recommend doctors or treatments or hospitals. We're just basically here to empower you and give you information in regard to cancer, okay? Now, I'm involved with the New York Cancer Resource Alliance, and it was a group that was formed in order to educate us, firefighters. A lot of us that operated at 9/11, and it expanded, as the chief said, we work in a toxic environment, and a lot of people are coming down with cancer itself. Now, at the Brooklyn meeting, we had a Dr. Bard that was there. All right, he's basically affiliated, and he does diagnostic screening using a 4D Doppler. Okay, it's a sonogram, and it was well received. I'm not going to take up too much time in discussing the sonogram, how it works. Some members here have been going down and getting checked. It's a very, very accurate form of sonogram, okay? I want to leave enough time here so we have a special guest here too. All right, I also want you to know that we have Len Dr, who's become a personal friend and is the director of New York Resource Alliance, okay? And we also have, thank you. And trust me, he beats me up every day. We also have Dr. Stoff, okay, I've got to know him personally, and I consider him a friend. He's an interactive clinical immunologist. It's a specialized field that they look at cancer and they study cancer from every angle, is what they do. And they study Eastern, Western type cancer, research. He speaks to a lot of medical forums internationally. He's recognized internationally also. So he speaks to a lot of these, I guess, research doctors, all right? But he cares about us. He's a very extremely compassionate man. And we asked him to speak to us, firefighters, our blue-collar workers, what we do every day. And it's funny that the chief was mentioning about cleaning our gear and what we had. And when we responded to 9/11, how many people actually came back to the firehouse and actually condemned or washed their gear, right? We actually put it on and we were back there, okay? I just want to share something with you. Bear with me, because if I miss something, Len will end up yelling at me at the end. I became with cancer awareness and Get Checked Now. I was asking a lot of questions every time I would see a medical doctor or an oncologist. And I basically would say, is there something that I can do to be proactive to make sure that I don't come down with cancer, okay? Besides having upper respiratory damage, I also have a low-grade cancer in my prostate, okay? So I was asking a lot of questions. And basically, I was told, no, there's nothing out there, which is not true. I made some phone calls. I'm not going to mention names where I called, but I basically called downtown. And I spoke to four different individuals, and I was asking them, is there something I can do in order to be a little bit more proactive, get checked? And basically I was told no. I was extremely upset for about a couple of days, because I know there's sonogram type scanning that you can do besides MRI, and also there's advanced blood work that I believe Dr. Stoff will actually talk about. And it's advanced blood work that they actually can test and basically come up with stage 1 cancer. They're able to see stage 1 cancer and tell you where it is in your body. At this point, it's about 4 organs. Very, very shortly, they're going to be able to tell you in more than a dozen parts of your body where that stage 1 actually comes from. So what's really, really important is that when someone is actually telling you where the stage 1 is, not to become a hypochondriac, that you're going to all these doctors, that you're dying or you're doing anything, but you want to be able to fight the fight. So if you have stage 1, now you can actually go, okay, and actually get tested. You can monitor it. You know that you have something. So by the time that we're getting tested now, and we go, like I go to Fort Taunton once a year, it's basically a glorified medical test with a PSA. By the time they're finding out what we have, you're a stage 3, stage 4 cancer. Where's the fight? If you're going to fight, you want to fight when it's a stage 1, not a stage 3 or 4. So you kind of learn there's stuff that you can do to increase and find out about your immune system. So I guess what I'm trying to say is that you have to be proactive. As the chief was saying earlier, you have to take responsibility. And you have to take responsibility for yourself. Don't be a procrastinator. I got to be probably the biggest procrastinator in this room. Okay? I'm sure I am. So if I'm going out and I'm getting tested, I'm done, I'm getting it done, you can get it done. And you do it for yourself first. And you do it for your wife, you do it for your daughter, your son, your grandchildren. You want to be on the job, you want to be collecting that pension, and you want to be enjoying some sunshine. And that's what you want to do. So, when I was angry for those 2-3 days, the anger basically, I had to call some personal friends to calm me down. And we discussed the political aspect of it. And then I guess my anger basically was turning at myself, at you, not getting tested and done. So, I love you guys. We have a brotherhood. I want to still ride every day. I want to go out there. I want to sit on the beach. So, let's do it for us, okay? Now, what I'd like to do is, I want to introduce a good friend and a guy that wrote me in. I don't know whether it was good or bad, but I want to introduce you to Len Dr. And if you could give him a warm welcome, I appreciate it. We're going to leave some time so we can talk to Dr. Stoff.
Hello, gentlemen. Thank you, Sal. This is probably the greatest honor that I can imagine receiving by having your attention. Because having met Sal a long time ago, we came up with this mission of reaching out to all the firefighters, all of the first responders, all the volunteers from 9/11. I was one of them. I spent 16 days down there like a knucklehead. And I say that because I thought I was going to be able to do as much as I was hoping to do, but it turned out that there was so much to be done, especially now. Now, I created something called the New York Cancer Resource Alliance, and what that's all about is the way alliances go, we're friends. We are volunteers. We do things because we want to, because we want to help another person, or everyone. And I never enjoyed volunteering more in my life than a mission like this, to let you guys know to get checked now, which is this stupid little button that I'm wearing. And if you have the brochures on your table, you should be able to see Sal's handsome picture in the middle, because he's holding up that button with pride. I'd like to read to you a headline that is on my desk, and I wake up to this every day. September 2018, FDNY's 9/11 death toll continues to climb. An FDNY union head says over 1,000 members have been diagnosed with cancer, respiratory problems, and other 9/11 related illnesses. Now there's a lot of numbers out there, and it's pretty scary, but at the same time, from what I understand, anyone and everyone who is in this room right now, you know, you're on the job because you're proud of what you do, not thinking about, you know, politics, not thinking about medical insurance. There's a fire, we're there to help. Our brochure, it's actually a pamphlet, it says, for many of us the fires still continue to burn. And that fire is more of a symbolic fire, saying that we have our own battles, okay? Cancer is not something that has a silver bullet. It's not something that has a formula that everyone here is going to catch it, all right? If it was that simple, we'd find the silver bullet solution, right? But instead, it all depends on so many different factors, which that gentleman over there, Dr. Jesse Stoff, is going to explain to us. I'm very fortunate to bring him into this meeting, because to me, Dr. Stoff is the encyclopedia of cancer. All right, as in, I haven't met anyone that knows more about this disorder, this disease. Now, during 9/11, I was a school teacher, and I owned a Softail. Does anyone know what that is? Come on, guys, be cool. Does anyone know what a Softail is? All right, thank you. That guy better know what it is. Well, around October, I sold my bike. I quit my job, and I started hanging out with doctors who were in the pile, explaining to me what's going on, and I never stopped listening to these kinds of resources, these kinds of doctors who are really, really smart. And then when I finally met with Dr. Stoff, he is like the ultimate guy in terms of explaining how to fight cancer. All right, he's the bravest man I know, because he is fighting probably the heaviest fight. I'd like to read you just a couple of numbers, if you don't mind. According to the Never Forget Project, more than 7,000 FDNY firefighters and EMTs have been treated for a 9/11 injury or illness now, almost 14 years later. So essentially, there's recurrence. I always tell people, cancer is sneaky. You think you beat it, it's coming back. Get Checked Now is not about anything other than staying vigilant, as Sal says, staying proactive, and staying on top of your own health. Now, over here is my friend Mike. Mike is a photographer. Mike, come on up here, please. Mike is representing Facebook. I'm sure you guys know what that's all about. And we have a lot of viewers who are learning, who aren't necessarily part of this meeting, but our organization is actually being heard nationwide. Now, I'm going to ask you for a small favor. Do you have, you don't have the button unfortunately, but you have the brochure that says Get Checked Now? Now is really the key word, all right? It isn't about Get Checked Later. It isn't about I'll wait a couple of weeks from now, because you just never know. So Mike is about to aim the camera at you. Mike, turn around. All right, I want you to yell at the guy. Say, Get Checked Now. Please, 1, 2, 3. Get Checked Now! Oh, come on, you guys can do better than that. One more time. 1, 2, 3. Get Checked Now! Thank you so much.
Again.
Thank you. Oh, we got it on this side. 1, 2, 3. Get Checked Now? Get Checked Now! Thank you. Thank you so much. Thank you. All right. So, just a couple of more quick things. Our program is about two things, awareness and education. Awareness means staying vigilant. Education means research, asking a lot of questions. And according to our pamphlet over here, Dr. Stoff's handsome picture is in there. It says, never stop until you are satisfied with asking as many questions as you'd like. All right? Which means from your doctors, from everyone. Prevention and early detection. Those are the words that you want to be able to hear a lot more from, because prevention is about keeping it away, and early detection is about keeping with regular checkups. Now, in closing, I'm about to bring up Dr. Stoff, Dr. Jesse Stoff. He's an educational encyclopedia on cancer. That is probably the proudest thing I can call him. All right, he studied all over the world, and his life's work is about research, treating patients' chronic diseases. He's here for the first time to introduce our next mission, which is not about screening and diagnostics, and all about treatment solutions. So if you have a pamphlet, you can see that in there. So if you want to read more, we are at healthscannyc.org, which is also in that brochure. So, and also I would like for you to know that You can ask him any question you'd like. I would just wait until the end of the presentation, and he's right over there. So you can come up to him directly, any question. It's free. If you go to his office, he'll charge you. Right? Here it's free. Anyway, Dr. Stoff, please, come on up. Everybody, round of applause. Thank you so much.
Good evening. Thank you very much for having me here this evening. I'm very happy to be here and to be of some help if I can. I'm Dr. Jesse Stoff. I'm a clinical immunologist, which means I focus on helping people rebuild and resurrect their immune system. I have been on the board of Cancer Treatment Centers of America. I designed all their initial immunotherapy treatment protocols 25 years ago, so this goes back a ways. In any case, I'm here to very briefly give you an overview of my perspective of how I look at cancer and how we address this in a more comprehensive sort of way. Let's start with the basics. Number one, where we are right now, where you are sitting, is classified as a cancer cluster. Long Island is a cancer cluster. We have the highest incidence of prostate cancer and breast cancer in the United States. And yes, men have breasts too. So as a result of that, there is a lot of research that's going on because this is a highly populated area, there's money in the area, there's people that want answers as to why this is, and what the common denominator is exposure to various kinds of toxins. Now, when you're on the job, you have that risk added to the risk of being on the job and the toxins that you're exposed to at the time, things that you inhale. And as the chief said earlier, clean is the new salty, because the toxins that you become exposed to can be absorbed right through your intact skin. You don't have to eat this stuff, swallow stuff, inhale this stuff. Just touching a lot of these things is enough to increase your risk of getting cancer. So nobody wants to hear that. Nobody wants cancer. It can be a hell of a thing to try to fight. So there's ways that one can approach this in a comprehensive way before you have cancer to see what's going on. And if you are diagnosed, there are ways of looking at this in a comprehensive way to generate treatment options. There is no one answer to cancer. That's a very important take-home message. If you hear nothing else from me tonight, hear that. There is no one answer to cancer. So if you have cancer, God forbid, and you go to a doctor and he says, this is the treatment program, well, that's just not true. There are many different strategies for approaching and dealing with cancer. For example, a very common cancer is non-small cell lung cancer. And I'm sure that you all know people who have had it or have passed from it. It's a very common sort of cancer. But with the new medicines that we have available now, the statistics for this disease have improved dramatically. So for example, straight up chemotherapy gives you an overall survival rate of about 3% with certain forms of non-small cell lung cancer. But with the newer immunotherapies that are available, just two of those medicines, Opdivo and Yervoy, raises the survival rate to over 35%. Add that to other small cell targeted therapies that we have available, and now you're in the 90s%, so overall survival with this kind of what used to be almost a death sentence type of cancer. But these medicines that come out that are available now are relatively new. Some of these medicines have only been available in the last 3 or 4 or 5 years. And so it's very important that if you are diagnosed, that you're working with a doctor, that you're working with a team who is aware of the latest breakthroughs in medicine. As a member of ASCO, the American Society of Clinical Oncology, and SITC, the Society of Immunotherapy of Cancer, I get updates on a weekly basis of new medicines that are in pipeline, new clinical trials that are going on, new medicines that have been approved by the FDA, new indications for medicines that were approved last week, so on and so forth. You take this information and can begin to build a comprehensive treatment program that greatly improves overall survival. And that's what the bottom line is. You want to get through this in one piece. So, how do I work with people who have a concern about cancer? Number one, I ask them a lot of questions. And my initial appointment with them is 2 hours long, asking a lot of questions. Then we do blood tests. The blood tests are looking at the following things. I look at biochemical factors. How's their liver doing? How's their kidneys doing? What's up with the thyroid? Because the thyroid is the critical organ, those hormones, for supporting the function of the immune system. Now, Long Island has the highest incidence of thyroid disease in the United States as well. So we're already behind the 8 ball just by having a glass of tap water. So we take that information, add it to what you're exposed to on the job, and then we start to see where the problems are. So the blood tests look at what's going on biologically, biochemically. Then we look at the structure and function of the immune system. The immune system is the organ system in our body that's designed to protect us from cancer, because every single day, every single one of us produces a certain number of cancer cells. If you look at any tumor marker, like PSA, the normal range is 0 to 4.0. It's not 0 to 0. Why not? Because every single day, we produce some abnormal prostate cells that the immune system recognizes as foreign and destroys them. When it destroys them, it releases these proteins into the blood that we can measure. And that's true for every form of cancer that's out there, which is why all the cancer markers have a normal range. And it's not 0 to 0. So you want to have a good set of blood tests looking at the structure and function of your immune system, because the risk of getting cancer is inversely related to the strength of your immune system. The stronger the immune system, the lower your risk. The stronger your immune system, the better the overall outcome if you're fighting cancer. So this is a very, very important piece of information. In addition to that, I do a bunch of tests looking at toxicology issues. What toxins are in this person? We look at blood tests for toxins. We look at urine tests for toxins, because if we can find these toxins, and we almost always can, there are specific treatment strategies for pulling these chemicals out of the body before they can trigger a cancer, or if you already have a cancer, pulling these chemicals out so they don't continue to fuel the cancer. It makes it much easier to treat. All these tests are commonly available. Any doctor can order them. All these tests are FDA approved. Very few of these tests are included in the WTC screening. It's up to you to seek out doctors and groups that are working with these more advanced technologies to see what's going on in your system, to see what your risks are, and see what the best way is to prevent a disease or to treat a disease down the road. If you're diagnosed, nowadays there are many treatment strategies. Yes, we have chemo, radiation, surgery. That's been around for decades and decades. Immunotherapy has been around for decades too, but has only come to the forefront in the last 20 years or so with the advent of many new pharmaceuticals that we have that can create a lightning fast response with much less toxicity and much better overall survival. But as these medicines are coming out, unless the doctor is up to date with what's going on, reading the journals, going to the medical societies. When I go to the SITC conference in November in Washington, D.C. every year, there's over 3,000 doctors there from all over the world for a week, hearing about the latest research, seeing the latest medicines that are available, all to help strengthen the immune system and fight the cancer using the immune system as a primary weapon. It's a very powerful weapon. But there's other weapons too. There's biochemical strategies. There's a whole field of oncology using targeted small molecules, as they're called. These are medicines, not chemos. These are medicines that inhibit or stop certain enzyme pathways in cancer cells and can shut them down with very few side effects. But unless you're working with somebody who's aware of these kind of breakthroughs and knows how to test for their use, then you're going to be looking at old therapies, off-the-shelf, generic therapies for whatever disease we have that have much poorer overall survival, and that's not what you want. To help identify what medicines could be useful, one can do a test that looks at the genetic structure of the cancer. The way that that's done is we fill out some paperwork, we send it to the lab. The lab requests a piece of biopsy material that you've already had. No one's chasing after you with another needle. And they can take those slides, run it through a very sophisticated piece of machinery that looks at the genetics and can sequence the genes of the cancer and see where all the genetic abnormalities are. Based upon those genetic abnormalities, there are medicines that can target those abnormalities and nail them and shut down the cancer very quickly, again, with far fewer side effects. Okay? You won't lose your hair, unless you already have. Okay, and some of you have, but okay. You won't be throwing up in the corner. You won't be laying in bed for days and days after treatment. You'll get the treatment. It could be a pill, it could be an IV, and as long as you're staying well hydrated, most of these medicines have essentially very few, if any, side effects or symptoms of taking them. These breakthroughs are coming through literally on a weekly basis, and it's important that you're working with people that are staying abreast of this information and can help you with it. So, when you get the blood test, you're looking at the biochemistry, you're looking at the immune system, you're looking at the genetic structure of the cancer. With this information, you now have treatment options. In the old days, we had what are called ASCO protocols. Protocols that were developed as a result of clinical trials from the American Society of Clinical Oncology. And these protocols were very generic. In other words, if you had lung cancer, you got this treatment. If you had liver cancer, you had that treatment. If you had, whatever it was an off-the-shelf, generic sort of thing. It's not that way anymore. With this kind of information that I'm telling you that's available right now, covered by insurance, this information will allow the doctors to target the cancer in a very individualized sort of way, giving much better outcomes. So in my practice, I may be treating at any one time a dozen guys with lung cancer, okay? And when I look at their treatment protocols, each one of them is going to have a little bit different protocol. Why? Because their blood tests are different. Their immune system is different. The genetics of the cancer are different. And therefore, the medicines that are going to be most effective for that individual will be different. So, take-home point number 2 is get the testing, find doctors who will do this sort of testing for you. Again, it's all FDA approved, covered by insurance, etc. It's out there. Ask for it. When you get this information, this gives you options. Important point number 2, with options comes hope. Without options, there's very little hope. Okay, you're left to the statistics of the off-the-shelf protocol. And you guys deserve better than that. So thank you very much for your time and attention. I'm not going to stand between you and you. Have a great evening. See you later.
Thank you, Dr. Stoff. I hope everybody learned something. I got a couple of things quickly. I talked to